In Lesson 8, we will focus our attention on cardiac rehabilitation in the outpatient setting. We will discuss the members of the cardiac rehab team, program components, and interventions. We will start with the members of the cardiac rehab team, which include the medical director, program coordinator, exercise training professional, dietitian, behavior specialist, and vocational counselor. Each has an important role to fill and works as an interdisciplinary team member. The program should include all aspects of secondary prevention of CVD, such as smoking cessation, exercise prescription, whether supervised or individual exercise training, nutritional counseling and weight management, stress, hostility, depression counseling or group support, management of hypertension with diet exercise, counseling and/or medication, diabetes management with diet exercise, medication, and/or diabetic education counseling, and dietary evaluation and counseling and calcium and bone building supplements for menopausal women. According to the American Heart Association, AHA, and the American Association of Cardiovascular and Pulmonary Rehabilitation, AACVPR, participation in a cardiac rehab program reduces recurrent, non-fatal MIs by 31% and a 5-year mortality by 25 to 46%. Risk factors that may be favorably affected by exercise training alone include loss of excess weight and body fat, lowering of total cholesterol and triglycerides, elevation of HDL, reduction of blood pressure, and improvement of glucose-insulin dynamics. Unfortunately, many individuals who would benefit are not referred or do not attend cardiac rehab in the outpatient environment, with only 11 to 38% of the potential candidates for the program actively participating. The initial assessment should assess ventricular function, including myocardial reserve, infarct size, presence and severity of ischemia or serious arrhythmia, or both. This can be achieved by a thorough medical history, patient-family interview, a physical exam, an exercise test, and blood chemistry panel. General management strategies include providing a safe and effective risk reduction program and monitoring patient conditions that do not meet criteria for cardiac rehab programs, such as unstable cardiovascular status, uncontrolled hypertension, conditions or illnesses that preclude exercise, and those at low risk for cardiac disease. The last group should be enlisted in a primary prevention program instead. Although there are several measures that assess risk of events, a daily assessment for risk for exercise should include continuous or intermittent ECG monitoring, telemetry or hardwire monitoring, quick look using defibrillator paddles, periodic rhythm strips, blood pressure, heart rate, symptoms and evidence of effort intolerance, and rating of perceived exertion, RPE. The goals of a rehabilitation secondary prevention program in the outpatient setting include provisions for a flexible, individualized exercise program, patient education, programs to enhance patient confidence and their ability to work at a safe functional level of activity, programs to reduce risk factors, assist and accelerate the patient's return to work, and the promotion of psychological, behavioral, and educational improvement. Interventions include patient-client instruction, coordination communication, and therapeutic exercise. Individualized exercise plans should include the following: specific exercise geared to the patient's needs and interests, the mode of exercise, which includes large muscle mass groups, intensity, which includes a target heart rate, perceived exertion and perceived dyspnea, a duration and frequency of exercise, resistance training, flexibility training, and the abilities to self-manage symptoms. This may include instructing the patient on monitoring their own heart rate, how to weigh themselves daily if diagnosed with CHF, and how to differentiate between chest wall angina and pleuritic pain. Formulas for calculating target heart rates are the following. For the general population, subtract their age from 220. For fit individuals older than 40, subtract their age from 205. And the Carbonin method uses their resting heart rate and adds between 40 to 60% to predict target heart rate. For lower risk patients, intensities may target 70 to 85% of maximal heart rate. For the elderly or individuals with severe ventricular dysfunction, exercise may target 40 to 50% of maximum heart rate. Upper limits for exercise intensity include angina, plateaued or decreased systolic blood pressure, systolic pressures greater than 240 millimeters of mercury, and diastolic pressures greater than 110 millimeters of mercury, evidence of ischemia on ECG, such as ST segment depression, increased ventricular arrhythmias are greater than 6 per minute, abnormal ECG responses, level 3 or 4 dyspnea, and other signs of exercise intolerance. Angina and dyspnea scales are useful in grading these responses, with grade 0s indicating no angina or dyspnea, to 4 indicating severe chest pain and infarction pain, to severe difficulty breathing. Other angina scales are rated 0 to 10. Patients may also be considered for resistance training if they have no evidence of symptomatic CHF, uncontrolled arrhythmias, valvular disease, unstable symptoms, or uncontrolled hypertension. Special care should be taken with patients with sternal wound healing or femoral puncture sites, however. Options for resistance training include elastic bands, cuff and hand weights, free weight including dumbbells and barbells, wall pulleys, and weight machines. Each has its pros and cons. Patients should always be taught to listen to their body's responses, and goals should be reviewed at least every 2 weeks initially. Other considerations for patient safety and comfort are altitude, cold, and heat and humidity. Anyone living and exercising above 3,000 feet should be watched for increased angina and dyspnea levels. Patients exercising in cold temperatures should be watched for increased myocardial oxygen demands and cold-induced vasospasm. And those living in hot, humid climates should be instructed to wear loose-fitting clothes, apply sunscreen, and exercise at cooler times of the day, and make sure to rehydrate.